During the first trimester of pregnancy, there are two common safe abortion methods. The first, medical abortion, also known as an abortion with pills. The second, vacuum aspiration abortion. In this video, we will detail what to expect before, during, and after a vacuum aspiration abortion. What is a vacuum aspiration abortion? During the first and early second trimester of a pregnancy, a vacuum aspiration abortion can be safely performed by a trained provider at a clinic or a hospital with a 99% efficacy rate. There are two types of vacuum aspiration abortions. Manual vacuum aspiration, which can be performed up to 14 weeks and requires a manual suction device called an IPUS. Electric vacuum aspiration, which can be performed up to 15 weeks and requires electricity for the EVA machine, which is not always available in low-resource settings. Usually, the procedure takes between 5 to 10 minutes and is performed under local anesthesia while the woman is awake. The majority of women will experience bleeding and cramping during and after vacuum aspiration abortion, but these symptoms will gradually decrease in the following days. Let's go through the procedure step by step. Step 1. Medication before the abortion. The World Health Organization recommends administering antibiotics prior to a vacuum aspiration to help reduce the risk of an infection. However, if antibiotics are unavailable, the abortion can still safely be performed. Clinics may also choose to give an oral medication, such as ibuprofen, to help with the cramping pain. Step 2. Tests before the abortion. Before proceeding to the manual or the electric vacuum aspiration, the provider might perform the following tests: urine pregnancy testing, determination of Rh blood type, estimation of the gestational age by an ultrasound or a pelvic exam, blood pressure measurement. Some additional tests may be performed based on the country's requirements. Step 3. During the abortion. Firstly, in the examination room, the woman will be asked to lay on her back with her feet in stirrups. Second, the procedure will begin with a pelvic or speculum exam. An instrument will be inserted into the vagina in order to bring the cervix into view. Some slight pressure will be felt. Third, the cervix will be cleaned with an antiseptic solution, and then the provider will inject a numbing medication next to the cervix. These injections should not be painful, and at most, it is possible to feel a slight pinch or pressure followed by a slight burning sensation and brief cramping. Fourth, the clinician will begin to dilate the cervix with instruments called cervical dilators. These dilators gradually increase in size depending on the number of weeks gestation of the pregnancy. Fifth, once the desired dilation is achieved, the clinician will perform the aspiration and remove the pregnancy with either A. a silent handheld suction device called an IPUS, or B. an electric machine. At this stage, some cramping and contraction will occur, but this will begin to improve once the procedure is complete. Sixth, after removal of the pregnancy, the provider may choose to do an ultrasound, and then the woman is allowed to rest. The entire procedure should not take longer than 5 to 10 minutes. Step 4. After the abortion. The vacuum aspiration recovery time is relatively short in the clinic. For women who had the procedure with a local anesthetic only, the recovery time is typically less than 30 minutes. For women who were given a sedation medicine for the procedure, the recovery time may be a bit longer, between 30 and 60 minutes, while the sedation effect diminishes. Once the recovery in the clinic is complete, the woman can go home. Some clinics may request to bring somebody to help the woman get home after the procedure. Once you are home, it is important to prioritize self-care. Post-abortion care after a vacuum aspiration abortion. After a safe vacuum aspiration abortion, women are often given ibuprofen or a similar pain medicine to use at home for any continued cramping. A follow-up visit is sometimes offered, and while this is not required, each woman should learn to listen to the recommendation of their own healthcare provider. There is no medically proven amount of time that a woman has to wait to do specific activities like showering, bathing, exercising, using tampons, or having sex. Generally, it is advised to wait until the bleeding lightens before introducing objects into the vagina, such as tampons and menstrual cups, and to avoid intense physical activity. But each woman is different and can return to her normal activities when it feels right for her. Though complications are extremely rare, you should seek immediate medical help if you experience any of the following: severe bleeding, high fever, dizziness, nausea and muscle aches, vaginal discharge that has increased or is foul-smelling. After an abortion, your menstrual cycle may return in approximately 4 to 6 weeks. Your fertility can return very quickly, sometimes as fast as 8 days after abortion, which means you can get pregnant if you have unprotected sex. If you wish to prevent another unwanted pregnancy, it is recommended to start a contraceptive method right away. To receive more information, support, and be referred to a local trusted provider near you, get in touch with our counselors by email at info@safetochoose.org or by live chat on safetochoose.org.